My conversation to you folks is going to be about what I've been doing for 40 years, and that's shoeing horses and working on the club-footed horses, what they've asked me to speak about. And I want this to be more of a classroom setup. That's what I had anticipated. I didn't know I was going to be in the big hall. More of a classroom setup, so feel free to interject any questions and comments as we roll through this, and make it a little bit more interactive than just a lecture. Definition of a club foot. This is going to be an acquired or a congenital flexural deformity. We've got some problem going on with the deep flexor tendon, that muscle tendon system. We're either going to have a shortening of that unit that's going to cause a very upright hoof capsule. And from there, we as farriers have to deal with the consequences. The anatomy that's involved in a club foot. We got the coffin bone, P3. Of course, the hoof wall that comes quite upright, and the deep digital flexor tendon, and then the subcarpal, or sometimes called the inferior check ligament, is very, very involved in a club foot and gets involved in our treatment as well. Just kind of a breakdown of the deep flexor tendon, kind of a rehearsal for those. We may have some younger folks in here. The deep flexor tendon has we're going to try head, but two heads, one that connects to the ulna, one to the distal aspect of the humerus, courses down the back of the leg, and turns into a tendon above the knee, lies on top of the suspensory ligament between the two splint bones, down over the proximal sesamoids and into the coffin bone. Its major function is to allow that fetlock to sink in a controlled manner, and the muscle head tightens, and that pulls on the tendon, which pulls on the coffin bone, which is attached to the hoof wall and brings the animal up on the toe. And it also has a check ligament, a subcarpal check ligament, or again, an inferior check ligament. There's a dissection of the deep flexor tendon. You can see it's broad, very, very strong. Tendons don't stretch, very, very little stretchability to a tendon. It's the muscle head that makes it function. And then here's the check ligament. This is the subcarpal or inferior check ligament. What's interesting is when you do dissection on club-footed horses that you'll find that the check ligament sometimes is even larger than a deep flexor tendon. It's much thicker and shorter. Now that check ligament functions as a safety line, and it doesn't have any stretchability to it. You can't stretch a check ligament. It wouldn't function as a safety line. So it'd be like washing the windows on the 20th floor of this building and your safety line's a bungee cord. That wouldn't be very safe. So the check ligament's designed to be able to prevent the fetlock from sinking all the way to the ground when the muscle becomes fatigued. So it doesn't stretch. Some of the clinical signs, radiographs, of course. It's really cool. When I go to these meetings, I always get all this great information, but then when I go out in the field and we're shoeing horses, how many of you guys got digital photography and digital radiograph equipment in your truck that you can do the work with? I mean, we're out there shoeing horses. Radiographs are great to have, but most of us can see a club foot without it, but it'd be really handy to find out the treatment. Hoof passion axis is always going to be broken forward. The dorsal wall over 65 degrees. Poor dorsal horn quality. And we'll talk a little bit about that because that was interesting if you heard Simon Curtis's talk. Along with the heels growing faster than the toe, which again is open for debate now. Thin soles beyond the apex of the frog. Sulci are going to be much deeper than normal. 70 to 80% of the time it's going to be in the right front. We're going to see a smaller shoulder joint as well on these horses. We're going to see one knee a little higher. Dorsal wall may be dished. Some degree of a drop sole depending on the severity of the club foot. Almost always the horse is going to stand with one limb back. And a lot of times you see muscle atrophy. I'm not a big proponent of limb length disparity. Sorry, Esco, wherever you are. I think that the muscle atrophy is probably going to be nerve problems. And elevating the foot doesn't regenerate nerve. Difference between a foundered foot and a club foot. On a foundered foot, you have a disparity between the dorsal hoof wall and the dorsal surface of the coffin bone. On a club foot, the whole unit comes up. The connection between the coffin bone and the hoof wall is still intact. It's not been damaged. And that's the difference between the founder and a club foot. The hoof passion axis broken forward. Now, this particular animal has a suspensory issue as well, but it illustrates very well that you have a broken forward hoof passion axis that you're going to see in every club foot, regardless of the severity of the club foot. We're also going to have poor quality horn. That's because the toe's loaded. If you guys got to listen to Simon Curtis, it's very interesting the work he's doing on foal growth, and he's making a determination as to whether or not the areas that are loaded, we always assumed that the toe grew slower than the heels. Not that the heels grow fast, just that compression retards growth. And his studies are trying to find out whether or not the horn tubules are growing at the same rate at the toe and the heel, but whether they're being just mechanically crushed at the toe. But nonetheless, we don't get a lot of toe growth on a clubfoot horse, and that we get, the horn doesn't have a lot of integrity to it. And the higher the degree of the clubfoot, the more severe the clubfoot is, of course, the less integrity that horn seems to have. Right front, 70 to 80% of the time. And that's what's leading some people to try to find a genetic marker to clubfoot. I know there's and I can't remember her name. I read just a brief little article about a research veterinarian who was trying to find a genetic marker for clubfoot, working with thoroughbreds. I don't know if it's the University of Kentucky, but that sticks in my mind. But trying to find that genetic marker to say that the clubfoot, on some instances, there's a hereditary component to it, which again would make a difference in our treatment as farriers. They all have these deep sulcus, very, very, very deep sulcus on these. Lots of heels, deep sulcus. The toe is really thin right at the apex of the frog. It doesn't take much to hoof knife those things and find out you've taken too much. The causes of these things, this is pretty good. This is where you go in at night in the bar and have 5 drinks, and then you know how it gets with horseshoers. You get 5 horseshoers in a room and you'll get 6 opinions on anything. And clubfoot is one of them. So congenital, that's an inherited characteristic, and that's the component they're trying to find. You can go down the thoroughbred race line and some of the Arabian lines, and you can see just a tremendous amount of club-footed horses, right front horses. You get a phone call from somebody who says they've got an Arab and he's got a club foot, and you go right front and they think you're clairvoyant. That's what happens. And then there's the acquired ones, and that's where we get into the discussion of how we're going to maintain and treat these things, the acquired. Is it a horse that's developing some pain, a heel pain, for some reason is loading their toe, and over a long period of time that subcarpal check ligament starts to shrink a little bit, and we develop a club foot? That suprascapular nerve damage, and you're going to see a major atrophy around that scapula on the muscle shoulder. That foot's going to come up. It'll be a club foot. Abnormal wear, environmental, some of the stuff that Brian Hampson did. Wow, you guys listen to that article? That guy's awesome, that study. And you can see that just environment and wear can bring those animals up and give them just a much exaggerated heels. And then we also have a condition that happens quite often in foals, and that's the rapid growth. Well, you'll have a youngster that starts growing exceptionally fast on the cannon bone, and because that subcarpal check ligament doesn't stretch, as that cannon bone grows, if the check ligament doesn't keep up with it, it brings the animal up onto his toe. And we start looking at the club foot. You guys know that. You're out shoeing somebody's horse, and they get a phone call saying they're kind of ticked off at you because you've been trimming this thing regularly, and all of a sudden now it's got a club foot. What did you do to my horse? That's some of the rapid growth that occurs on that cannon bone, and that subtarsal check ligament is not going to keep up, and it starts bringing them right up. And we get involved in that, which we'll talk about pretty soon, trying to help some of these youngsters. This is the muscle atrophy, and I disagree that this is a limb length disparity, one knee's higher than the other, that every time you see a club foot, you've got one limb longer than the other limb, and we need to add a bunch of different pads to it. I've never been successful in trying that. We found out that that this is usually some kind of nerve damage that's done to a horse, and that's why the muscle becomes atrophied. And shoes and pads don't rejuvenate that nerve, and we don't have too much for that. When you're looking at a club-footed horse, your treatment's going to depend upon something like this. You'd be surprised the number of horses you find that have that subscapular nerve that's been damaged to some degree, and they're going to be a club foot. And that's not a matter of trying to mechanically take them down. Now we're just going to treat the existing condition, shoe them for what they are. So what causes the lameness? Well, this is a kind of a sedate group today. Should I bring in barefoot trimming conversation? I was waiting for that. If you guys went to the Daisy Bickering, she had an awesome little thing going last night. They were trying to get the modality. What would be the modality that you would leave a horse barefoot in order to rehabilitate him from a lameness? And I promised her I would shut up as long as I could. I only had one little outburst, but it's interesting. I'm trying to find when you would take a club-footed horse and leave a club-footed horse barefoot in order to rehabilitate him. I mean, I think you'd be causing more damage to it. You'd have to put something on the foot. If you're anti-steel, you'd end up with shoes, but something to elevate him. These guys get very thin soles from the coffin bone pressing down on that sole, and some of these get just paper-thin soles. Guys use a hoof knife way too much on a clubfoot horse. That stays in your shafts most of the time. Lots of bruising. That's because that coffin bone is compressing the sensitive laminae between the sole and the bone. So you'll get a lot of sole bruising. P3 gets trauma. Doesn't matter how long that horse has a club foot. At some point, that coffin bone is going to give up on him. And he's going to start having difficulty in movement, going to have some lameness issues because the trauma caused on the tip of that solar margin surface of P3 is going to get tagged over a period of time. And then another lameness is going to be Farriers dropping heels. This is a big one. Lots of guys are still under the impression that every foot needs to be the same toe length and needs to be the same heel height, same angle. So they come out on a clubfoot horse. If a client calls you up and says that I'm shopping Farriers because every time somebody comes out, my horse is lame for 2 weeks, and you come out there and see a clubfoot, it's somebody just indiscriminately dropping heels without a plan. And they're stinging that subcarpal check ligament. That horse is going to be lame for a couple weeks until he gets enough heel or wears enough toe until that check ligament doesn't hurt anymore. So Farriers create a lot of the conditions on these club-footed horses, particularly the milder ones, the grade 1 club's foot, where it's more difficult to tell whether he's really super clubbed. Dr. Rick Redden gave us some clubfoot information. He decided to put them into a category of grades 1 through 4. And it's kind of universally been picked up now. If your local vets don't use this, it's kind of a good idea to get through them. It's nice. I require my students to know this well so that when I get that panic phone call or that email from them and they're describing a foot, we're both thinking about the same foot at the same time. So a grade 1 club foot, that's going to be a 3 to 5 degrees difference between the 2 feet. You're going to see a fullness at the coronary band. Dr. Redden says rings even at the toe and heel. I find a lot of grade 1 club don't have the rings. You just don't see those. They're not very prominent. These have got just a mild pull. This is a drawing that he gives of them. You can see that they've got a fullness on that. You'll also see some cleavage back in the bulbs. You'll see more of an indentation between the 2 bulbs in the back of the foot. It gets progressively deeper as the animal goes through the grades. Some horses start out at a grade 1 and stay that way for life. Some go to a grade 1, then a grade 2, and then some go all the way up to a grade 4 and into the rendering plant. Here's a grade 1. This is a grade 1 that's not been worked very often. And you can see the fullness at the coronary band. That's always indicative of a problem out there. You got this little luxation of the coffin joint. So it's a pretty good tell on these animals as to whether we've got a club foot. Shoeing on these guys. Now, there's different ways to look at this, and one of the problems I have is I make a living shoeing horses. I feed the family, make the mortgage payments, and so it's really nice to be able to have all the wonderful things these guys talk about the Mother Teresas of the horses. But we got to make a living on how do we shoe these things, and what do we do to keep this animal sound so that people keep paying us. That's the basis of what we do. So on these guys, we always start on the low heel side first. And I apologize if this sounds a little amateurish to some of you guys who've been shoeing for a while, but that's the gig they gave me for the summit. But low heel first, that's the one we want to trim with. You start out trimming that low heel foot, and on a grade 1, you can come pretty close to matching them. Within a degree or two, you can match those 2 feet. We want to take the club foot, and we want to fit that really full, and the non-club foot pretty tight. And your lower level hunter jumper folks, dressage, just the lower level folks, you can have that foot looking pretty much like it's not clubbed to them. Because you'll get the complaint that, the last guy started making my horse club-footed. Well, that's because the other guy knew what he was doing. He cleaned it up. It's all cosmetic. He's still club-footed. I'm a proponent of pads on all club-footed horses. That coffin bone's going to take a beating. So either it's going to be pads or going to use the Equithane sole packing, but something to protect the bottom of the foot. I like to have even a grade 1 foot left a little long, sole kind of heavy, and put them on a shorter schedule, if at all possible. Now, grade 2 gets to be just a tad bit different. It's a little bit more of a severe. A grade 2, we have 5 to 8 degrees difference between the feet. We're going to have rings, and they're going to start that process of being wider at the heel and converging at the toe. Going to have a significant sole drop on these. And to do these, it requires a paper test. That's the easiest way to do that. Whenever you come out to a horse who's got long-standing high heels, and you're not exactly sure how much heel to take off, this paper test is an awesome way to be able to make a determination. I'm going to show you that in a second. So here's a grade 2 club foot. This is Rick Redden, the drawings they have of those things. You'll see that the fullness is even more prominent at the coronary band. And the cleavage between the bulbs will be even a little bit more deeper. The sole becomes a little more flat. And here's the paper test. You take a horse and you trim the heels and you put him down, let him stand there for a second, and if you can slide a piece of paper underneath his heels, he's not bearing weight anymore on his heels. That's where you need to stop. So on working club-footed horses, particularly mature horses where there's nothing else we can do but maintain that hoof capsule, and it works on virtually every kind of high-heeled horse. Some of you guys working, I'm originally from Wyoming, so that don't touch those heels, boy, stuff was embedded in me. You got a lot of heel, that's how you take them. Yes?
Well, do you think putting a wedge pad, sliding wedge pad under that toe backwards and playing with that until you get that gives you an indication pre-trim as to where that's going to up?
Yeah, if I'm out shoeing someplace that doesn't have a nice flat hard surface, I'll take a wedge pad and just duct tape it on backwards and let the horse stand. And if he's comfortable on the heels, I know I can take the thickness of that web pad, that's how much I can remove from the heels, and then I do it again. So yeah, the wedge pad works great if you don't have a nice, smooth, flat surface to be able to take the paper test. But this is the indication of how much heel you take off every time. And you'll find that most of these horses at a grade 2, grade 3 club foot, this is where you go every shoeing. You're not going to get anything more than this. If you try to take more than this, you're going to sting that subcarpal check ligament, and you're going to have a horse that's going to be off for a week or 10 days. No, I pretty well just set them down and see how they're comfortable. It's just kind of a visual thing, how much heel to take off. This little guy, you can see that we did start doing some trim on him, and he's done. Even though you look at those heels and think he needs more heel off of them, that's whether you're going to leave him barefoot as a trim. Yes?
Yeah, would you cover a little bit more about the fullness at the coronary band and as you go through the grades, why that's increasing?
Oh, that's going to be because of the broken forward axis. Yeah, it's going to be a shortened muscle tendon unit, the deep flexor tendon, pulling on the coffin bone and bringing the coffin bone down. But since it's not a founder and we have a firm attachment to the wall, as it's bringing forward, that coffin joint is kind of knuckling forward, and that's giving us that big bulge in the front. So that the steeper it becomes, the more the bulge is on the coronary band. So on these little guys, that's all you can get. And if you're going to leave them barefoot, then you leave them barefoot. That's what you can get on the heels. You're done. Here's a grade 2 club. You can see you get to the point where using a paper test, sometimes the heels are going to be the same height as the toe, and that's all we can do. As a mature horse, you can't. The concept of being able to stretch that unit down is just misleading to the clients. They end up with a lame horse every time you go out to shoe this guy. That's what he's got. Working on a grade 2, again, we start with the low heel side first. That's what I'm going to trim first, the low heel side. It makes it a little easier to get him close. But I'm not going to be able to match the angles on a grade 2 or above. That's not going to happen. Some of your clients are really, really hooked on having the same angle on that. And so they want a wedge pad on a non-clubbed foot. Now, to me, it doesn't make any difference. If a horse has one coffin bone that's gone, it doesn't make any difference in the way he travels as opposed to 2 coffin bones gone. So if they want to club them both up, they club them both up. I don't think it's unethical to do that if that's what the client's looking for. And a lot of them will look for the wedge pad on the non-heel side because they want to see that symmetry. And it does give them a little bit difference in the gait. But remember, when we go into a grade 2 club foot, we're not talking about some top-end performers. We're not talking about the big, big performers on that because these horses won't stay sound for that. And again, we're going to paper test the heels every time we trim these guys. They're better on a shorter schedule. Yes?
Is there any advantage to, let's say that foot is in contact with the ground, is there any advantage to if I would remove, let's say I remove 2 degrees of the heel in order to get a better base of my foot? Is there any advantage to doing that or replacing it with a 1 or 2 degree wedge pad in order to keep the horse comfortable but maintain a bigger base for my foot to get more surface?
Yeah, I'm more of an advocate of using a wedge shoe. I mean, I'll fire up the forge and pound out a shoe. Wedge pads always seem to create havoc in the heels for me. I've never had a good luck with wedge pads over a long period of time. But the higher the horn tubules are, the longer they are, the more distortion you're going to get in that foot. And you'll see on these club-footed horses when you dissect them too, that digital cushion is just shot. It's no longer functioning in clips of the ground. The heels have all pinched in. The digital cushion is not a functioning entity anymore for that horse. And lots of concussion. But yeah, you can drop the heels, try to get more of a normal foot physiology, and then build it back up. And I like a wedge shoe. And they make them now. You don't have to fire the forge up. You can get nice aluminum shoes that are wedged up and try to get the same effect to the horse. And that's the problem with club feet. The longer the heels get, the more problem you're going to have outside the club foot because they're going to start pinching in, rolling in pretty bad. Now here's a grade 3 club foot. Now we're getting to a horse that's probably not a riding horse. It's going to be some brood mares that folks have they want to get another baby out of. It's going to be one of the pasture ornaments. But it's not going to be a functional rideable horse for the most of us. We're going to have a dished wall on this. It's going to start getting severely dished. The rings become almost twice as wide at the heels than they are at the toe. And severe bruising in the sole where that coffin bone has been pushing down. The sole's very, very thin at the apex of the frog. And radiographically, you're going to start showing some lipping of the coffin bone. You're going to see where that starts to look like a little ski slope, where that solar margin surface of that coffin bone has been thinned out, and that's creating some issues for the horse. And here's again one of the Rick Redden drawings showing a grade 3 club foot. Now these guys are not sound. You can usually get reaction on their sole with your thumbs. You don't really need a hoof tester on these guys. And as they progress through this club foot, that coffin bone starts to decalcify more and more. Here's a mild grade 3, and this guy's career is going to be quite limited. What we're looking to do on a grade 3 as Farriers is protect the foot. Protect it as much as we possibly can. Another grade 3, you can see, look at that luxation you got in the coffin joint. Just start bulging forward in the coffin joint. No integrity to the wall, the toe. That starts to bear weight. It just starts to crumble. The walls become very thin. In radiographic, you start to see this lipping. That coffin bone looks like a ski slope. And this is Wolff's law. That's an axiom that says that bone remodels according to stress. And as the stress is placed on that coffin bone, should be sitting at about a 3 to 5 degree angle inside the hoof capsule. But when it starts sitting up here at a 65, 70 degree angle inside that hoof capsule, the tip of that bone just starts to curl up. And then after it curls up, we're going to start seeing some other problems with it demineralizing. Remember that the circumflex artery and circumflex nerve run right around that solar margin surface of P3. So as that bone tips up over a period of time, we start compromising the circumflex artery. We start compromising the circumflex nerve. It creates a lot of pain for the horse. And then because of the tourniquet type effect we're going to get at a grade 3 and above, we're going to start seeing some infected coffin bones over a period of time. Shoeing on these guys, it's kind of simple. Our primary concern is going to be protect the foot with any modality you can. Now, this is where I really love boots for the client, because nailing to these guys is not fun at all. You know, pads are, it's a tough choice. You get an aluminum shoe, you can really concave because we don't want any sole pressure. The sole's dropped on these guys. And a pad, boots work well. The drop sole is significant on these things. So just leave your hoof knife in your shaps. Well, then the grade 4. A grade 4 is about the end of the road. We've got a hoof wall that's really 80 degrees or more. I've seen them almost beyond vertical on a grade 4, heavily dished. The key to a grade 4 is going to be when the horn at the heel is higher than the horn at the toe. You know, normally you would see the coronary band drop to the heels. On these, you see it the other way around. And whenever you run across a horse that has heels higher at, the horn is higher at the heels than it is at the toe, my recommendation is get a vet workup on it. These horses, the integrity of the wall is completely gone. They're walking on their sole. Extremely painful. Again, this is the rendition. You can see that coronary band just starts to bulge more and more and more the higher these grades get. You end up with some pretty yucky feet. We clean this one up just to show that the apex of the frog just blends in with the sole, just right away without any kind of work at all, and just got massive amounts of bruising with his foot, very deep sulcus. You can elicit pain in this horse just pushing with your thumbs. Shoeing for these guys, I wish you luck. These are the ones you drive a nail and they're up in the rafters. It's kind of like working on an acute foundered horse. Most of these, the coffin bone is gone. If you radiographically look at them, you've sometimes 50-60% of the coffin bone has been deteriorated. You'll have an infectious osteitis going on inside the foot. And really it's time for euthanasia. That's why it's great to have a vet workup, because most of the vets will recommend euthanasia before they'll start working on the foot. On a grade 4, be careful with sometimes, because in our enthusiasm to help the horse and help the client, if you're the guy out there trying to dress back this nasty hoof wall that's sticking way out, you may be the catalyst that precipitates this horse deciding to lay down and want to die, because there's very few fibers left attaching that coffin bone to the hoof wall. The coffin bone is way too small. Okay, now the young horse. This is the fun one because we can do something about club feet. We can get in with the veterinarian and we can start doing some interesting things. A subcarpal check ligament desmotomy. Desmotomy is just a term that the vets use for cutting a tendon, or a ligament rather. A desmotomy is just cutting a ligament. They like them under 2, but I've worked on a couple of horses that were 7 and 8 years old that reasonably had good success with this desmotomy. And we can get involved pretty actively pre- and post-operatively. If you've got local vets that you have a good relationship with and they've never done one of these things, it's kind of cool. Find a horse that you can work on with these. It's a lot of fun. Again, we've got the subcarpal inferior check ligament, and that shortens. That unit is shortened. And what prevents the heels from dropping is that subcarpal check ligament is not long enough. So the surgical procedure is just to go in and cut that. And then we have about a 6 weeks window of opportunity where we can get back to a normal foot physiology. As farriers, we can maintain that foot back to a normal foot physiology and have a pretty good run. This technique was developed years ago in Sweden with their standard breds. And they had these horses that went on to a 10, 11-year racing career after the surgeries as yearlings. So it's proven quite successful. But there's some parameters that you need to do. Prior to surgery, if you get a youngster, you and the vet may want to go 1 to 6 months of trying to do the corrective work. It may be that we've got a very accelerated growth on the cannon bone, and we may want to try to some polyurethane toe extensions to lever him back and trimming some heels, because we don't have a lot of body weight, so we're not going to have the same kind of pain problems a mature horse has, and see if we can kind of catch him up, whether he's really going to need surgery. And that can be anywhere from 1 to 6 months, depends on you get a young quarter horse, you can probably make that decision relatively quick, 6, 8 weeks. Get a thoroughbred or a warm blood that's really growthy, you may want to take up to the 6 months after that. But after 6 months, you got to make a decision. After you've been working on this guy for 6 months, what are we going to do? And of course, the price is always a consideration by most of our clients. And then, of course, we've got a follow-up care that goes with it. So what's our role? Pre-surgery, we go in there and increase the heel height. I hate it when a vet wants to do these things on a horse that's a 2-year-old that's foot's a nub. They want to do the desmotomy right now, and we've got nothing to work with. So try to be do a preemptive strike on this thing. Get a hold of this animal. What we'd like to do is I'd like to spend about 6 or 8 weeks where we can elevate the heels. And you can do that with nailing. We can do that with a variety of other techniques. We want to elevate the heels for a while. Now, I know it sounds the opposite of what we want to do, but elevating that heel is going to take the pressure off the coffin bone in the sole and going to start thickening that sole. And in a youngster, that thickens pretty quickly. You know, in a month and a half, 2 months, you're going to have a pretty thick sole that's going to be able to support this horse later on in life. Right before the surgery, as they're prepping this little guy before the surgery, is when we do our trim. And I really recommend you do the trim before the surgery. I've done them both ways, before and after. It's not near as much fun after. It's hard to get them set up just exactly right when they're laying down, or when they're groggy, or after the surgery when you're tearing off the bandages and removing some stitches. And so I really, really push for doing this stuff right before they do the surgical procedure. And from there, we lower from the apex of the frog back. Don't worry about the toe. Don't try to get a flat foot. We just want to go for the point of the frog, and we want to bring him back until we have a normal heel height that matches the other side. From there, you're going to put shoes on. On most of these youngsters, you're going to put some kind of shoe on. Yes. Yep. And you can bring them down, and the first time you do it, it's kind of wow. You're taking a lot of heel off these youngsters.
I've had a colt that instead of cutting it, they relax the tendon. Am I off on? Is it still a club-footed horse at that point when they cut it on a young horse and are able to give it a shot to relax that deep digital to allow him to drop in the heels?
No, so what you've got there is you've got an animal that's starting to become club-footed, given that appearance, because he's got some pain. He's got some nerve damage or pains, and everybody in this room is, you spend your life with your fanny higher in your head, you're going to have a sciatic problem at some point, and that's just a muscle cramping around a nerve. And so muscle relaxant does that, and if he doesn't respond to that, then that means we've got a check ligament that's too short. So the toe extensions out there, we'll show you a couple of these toe extensions. I used to put toe extensions on when we do the surgery. The problem is that it takes the dorsal wall and starts to tear the dorsal wall pretty significantly. I'm not an advocate of toe extensions anymore. I'd rather use a wedge. I'd use a polyurethane wedge on some of the youngsters, or I'll use a reverse wedge pad on an older horse. I like wedging up the toe to increase the pressure of the heels much more than I like sticking stuff out front to leverage them back, because I always end up with a bunch of dorsal wall tear every time I've tried that. So our role is we're going to move the extensions after about 10 days. And the horse is going to be in stall rest, and that's why some of that vet tech super fast stuff works really great. We're going to put them on about a 3-week schedule, and then a normal trim after about 90 days. What we're trying to do as farriers, we're trying to make sure that the animal maintains heel contact for about that 6 months post-operatively. We want to make sure that he's always got his heels down. So I want to come back and visit him on a little more regular schedule. I won't do these unless the people agree to at least a 4-week schedule after we get him set up. Every 4 weeks I want to make sure. And then they got to go out and check him all the time. Because if he starts to come back up onto his toe, his heels leave the ground, it could be that the muscle head of the deep flexor tendon has been stretched so much that it starts reacting to that pain, contracts. At the end of 6 weeks, you have a club-footed horse again. And they're upset with you and they're upset with the veterinarian. So that 6-week window of opportunity, we want to make sure, and that's when they would do the injection for sure on those, to get them to relax that muscle if they're starting to have spasms in the muscle. This is what it looks like right after surgery. On the left, we just popped him up. This horse was a long yearling, getting ready to go into cutting training. And so we were going to put shoes on him anyway. And you can see, just screw together some wedge pads, put them on. We left him there. And it helps him give a thicker sole. And the veterinarians like it because it kind of softens up that back area. You know, when we do our little anatomy stuff, it's really cool because we can pull this thing all apart and the skin's over here. And here's the deep flexor tendon and here's the subcarpal check ligament. But you get all that stuff together and you have an incision about 1 inch long. It's pretty tricky. You know, as the vet, you don't want to be the guy that's cutting the suspensory ligament when you think you're doing the subcarpal. And you can see they come down. The one on the right was right after surgery. I mean, this was 20 minutes later. 20 minutes later, right after surgery, you can see how you get that foot back. You get those alignments. In this x-ray, can you see who was asking about the bulge in the corner? You can see the bulge in it. You see how it goes with the coffin joint? Yeah, the extensor process of P3 really starts pushing against the coronary band. And so right after the surgery, these things come right back down, and then we're it. Yes, sir?
How often do you visit the surgery back? Do you have to readdress it?
In my experience, I only had one, and I really am convinced that one was the client. I was convinced that the one was the client who just kept missing appointments. I think the animal started having some spasms in the muscle, and came up. She wasn't maintaining the feet. You know, it's the people who think that the vet comes in, does the surgery, we do the trim, and then they don't have to do anything else, and the animal will be fine. So there wasn't any follow-up care to it. Some of the vets don't like it because the success rate gets much lower the older they get. After about 2 years old, you're going to have some changes in the coffin bone. You may end up with some permanent damage to the cushion, to the digital cushion, where it doesn't really come back and rejuvenate itself. So that's going to create palmar heel pain for a long time for the horse. The sole stays thin. You never seem to really get that sole back. And the body weight on these horses means they start spasming a lot more. They start having more problems after surgery. Like I said, we did one that was almost 8 years old, and it came out really well. He still had a foot that really never had a lot of integrity to the toe. He didn't have really strong heels, but you could kind of match the feet when you trimmed him. So I think that's why they like the success rate higher the younger they are. If you're looking to fit a toe extension, the big question comes as to how far do you stick that thing out? It can't be arbitrary because you're going to create some problems for the horse, but that dorsal wall tearing, which is the big problem with toe extensions. And so what you do is kind of figure out what that normal angle would be, if that, based on the other foot, and you start to curve your toe extension right about the area where that wall would touch it, if it was a normal, healthy foot. And that's pretty much the average of where that toe extension should be on a horse. And again, you're going to end up with some tearing every time. Keg shoe with a welder, you can do all this stuff. Keg shoe with a welder, you don't have to be the handy-dandy forge master guy. And you just want to stick that out even with the ground level and then start curving it up about the distance that the wall would come down normally. On some of these horses, like this one, we're just going to use a little toe shoe because I want to have access to the heels to be able to remove some heels if I want to. And these things only stay on. On a young horse, we're looking at 10, 14 days max that these things stay on. I know Dalmer makes a cuff that you can put on. We've done some young horses that were 7, 8 months old, and we were able to accomplish what we wanted to accomplish just using the equithane. We didn't have to put anything else on the foot. Able to get some toe elevation, a little bit of extension on these guys, and not have to do anything to the foot. Any questions on that subcarpal check ligament desmotomy? That's really a cool thing. If you're in a little local area, bring it up to your vet. They get all excited about it if they've never done it. and try to find a candidate, because it's pretty miraculous. Okay, so club foot. This is just bad trimming. It's not a club foot. If you start looking at this thing, you'll see that we don't have a club foot. We're going to have a much steeper angle. Just because we have high heels doesn't mean we have a club foot. There could be all kinds of things for the high heels, from that cowboy mentality of never taking heels off a horse to the client's preference. But that's not a club foot. Again, good idea when you're dropping these heels the first time you see these horses, use the paper test. Or take your wedge pad, tape it on backwards, both ways, to be able to see how much heel you can take off this horse to get him back to as normal as you think he should be. Lots of horses have too much heel. That too much heel is starting to cause problems in the plantar aspects of the foot. Here's a guy, it's a club foot. You can't maintain these, the people that maintain these horses barefoot are not going to be riding them. They're going to be pasture animals, because they're going to develop a lameness down the road, guaranteed. If we can get the sole off the ground and get some protection to it, the horse is going to have a much longer, much happier life. How do you like this guy? But what's interesting, and we offered to trim this thing free, and they wouldn't let us, and so we turned him into animal control on this guy. But look at this foot. Isn't that amazing? Now, when I look at that foot, it's cylinder. I don't see any dishing. I don't see any rings. I don't see anything that would tell me that this is like a grade 3 or grade 4 foot. It's just a foot with a lot of heel. What had happened to this horse, we found out, was that it had been in a wreck. You can see just right above the knee. Had been in a pretty good wreck, had scar tissue. The deep flexor tendon had just thrown adhesions out all over the place, and he was incapable of dropping his heels at all. They had some animals that were in really bad shape along with this one, but I would have loved to have been able to work a little bit with it. And it may have been that you do a little paper test on this horse and you couldn't take any heel off of him, because he just didn't have the ability mechanically to let that fetlock sink. Grade club foot. We're looking at a grade 2 club foot on that horse. Those heels have got to come down. If we don't get those heels down on that horse, I can promise you that coffin bone is going to deteriorate to the point where you have a non-functional animal. But if you take off too much heel, you're going to start to rip and tear that subcarpal check ligament, and you're going to have a lame animal.
I've seen young colts where folks are trying to extend that toe too much, too fast, and rip the foot off.
Oh, you'll tear the whole dorsal wall off by putting those extensions. The systems don't stretch. So if you think that the animal it's just got a fast-growing cannon bone, we want to keep some pressure on it to get that check ligament to catch up with it. But if that's not the case, if it's just a shortened ligament, they don't stretch. And I've had these conversations with veterinarians before that says, let's let them stretch that tendon back. They don't stretch, so systems wouldn't function if they stretched. They have some ability to stretch, so in a clinical setting you can say they stretch because they don't tear that easily. But they don't stretch like a bungee cord. Here's another one we ran across. This was a fun one. Because I got to school, everything gets magnified. And we came across this, and this was okay paper tested. And we ended up with 3 students that ended up working on this horse, because one of them would pucker up and say, that's it, and still was doing the paper test. When we got done, we ended up with a foot like this. And it was much better off. The horse was much happier. This is the before and after. And you can see that by using the paper test, you can see how much heel to get off. This coffin bone was just banging on the ground on the right-hand side. And you just keep dropping those heels until you can no longer. And that predisposes, of course, that you have flat trim on your heels. If you round the heels up with your rasp, the paper's always going to slide underneath it. How's that guy? That's the dorsal surface you're looking at. That's kind of cool. This was just a picture sent to me. I didn't see that one. And he's still got shoes on him, so it must be a good shoer. You guys have all had that, I know. This was an impound that came in as a grade 4 club. The coffin bone was non-existent in this. You can see that the horn is much higher at the heel than it is at the toe. severe dishing. You could take that foot and you could just, there was no coffin bone attachment to it. Trying to dress back that dorsal surface, chop that off, it'd be a useless endeavor. You would again be the catalyst that causes that horse to roll over and die. Okay, here's the scenario for you guys. You get out of horseshoeing school on a Friday. On Monday, your first professional call. This kid called me, and I didn't know he had such a high voice. Mom! And I said, you can't call me at 8 in the morning. You know I start my lecture. He goes, the client's here now. So he sent this picture. And it's a paper test. I start dropping the heels. A paper test. Yeah. Yeah, I seen the hunter fit. Yeah. Isn't that incredible? I'd love to have been able to trim that one. That'd have been cool. So that's a rhinoceros foot. Feet. No, that's a foot. They're they're feet. They're three-toed animals. And you can see they have little club feet. And normally about an 80-degree dorsal wall. I have the extreme pleasure of being able to work on a lot of exotics in San Francisco and Oakland and some San Diego zoo animals. And this was a female that has gone from that to that. So it's one we're going to be working on hopefully another month or so. This is an 8,000-pound white rhinoceros. Well, we start out by hoping the vet knows how to sedate well. And on that, it's going to be on the exotics like this that we use it. That in a zoo setting, you get these kind of problems. The sad part is that they only call me in when they're getting ready to euthanize the animal, because there's a 50-50 chance the animal is going to die when they sedate him for whatever footwork we're going to do. They go through capture myopathy. Very easily go into shock and die. What I use on these is a mechanical grinder. You can put them on a 4.5-inch wood grinder, a couple bits on them, and you do it with wood, and it hogs some foot away. And on these, I'm going to have to put a team together for this because we're only going to have about an hour. The white rhinoceroses are a little bit different in that they don't take a darting, they don't go down. So you dart them and they fight the sedation standing up, and you can't knock them down or you'll kill them with too much drugs. So this is the cool part. Anybody here old enough to remember Wild Kingdom? Yeah? Right? And they had Merlin Perkins that sat in the Land Rover, and he went through like 18 gyms. Jim is down there wrestling that 30-foot anaconda, that kind of stuff. This is what happens in the zoo settings, is that they finally sedate this guy, and then they want the farriers, I guess, the size 5 hat, size 50 shirts. They want us to go out there. We got to put ropes on them and knock this 8,000-pound animal down because they will not go down with sedation. And then they do some injections in a vein in one ear and put them down. And then we just start hogging back the dorsal surface. They're going to take some radiographs and find out where it's at. These guys will founder on those toes, like giraffes. These guys can founder on 1 toe, 2 toes. So, what's that? Oh, yeah, she's crippled. She's crippled bad, yeah. Now, we were scheduled to go do her before the summit. I thought I was going to have some really cool pictures before the summit, but they found out that the male that's been her lifelong companion, they have no place to put him, and he doesn't like anybody around the female. So they had scheduled us to go out, and the vet made a dry run, and he goes, well, where are you going to put that big guy? And they go, I don't know. So and we decided to postpone. Yeah, and the pad underneath these things are like an elephant's, same thing, and it has the consistency of a frog. Has the exact same consistency as a frog, yeah. And sometimes we worked on an Asian rhinoceros a couple years ago. They're indigenous to swamp-type environments, and that pad gets completely torn out underneath behind that nail. But hopefully we'll have some fun pictures to show. I was going to send my wife in first. Let her start the trim. That's how we do it. Yeah. Okay, well, thank you very much.